I just want to remind this room and everybody watching that the budget for this division is $307 million in fiscal 2026, with $13 million allocated for harm reduction activities. Just to do a recap of some 2025 statistics, in 2025, Toronto Public Health distributed 1,799,272 needles, many used for intravenous fentanyl injection. 943 smoking pipes used for the inhalation of fentanyl and crystal meth, and 579,668 crack pipes for crack smoking. Many in the community wonder if we'll break the 2 million mark for needles in 2026. I guess we'll have to stay tuned to find out. Now, obviously, the chair and the medical officer are ecstatic about these numbers, as evidenced during their budget meeting in which both discussed the need to add harm reduction distribution capacity. Now, on the topic of harm reduction, with all these harm reduction supplies that have been distributed, I think it would be very wise to show these supplies in action on the streets of Toronto. Here we see this individual using their city-issued meth pipe, enjoying his pastime of meth smoking on the TTC. Another individual with their city-issued crack pipe, smoking it also in the TTC in full view of citizens and their children. Here we have somebody in the throes of fentanyl addiction on a GO train. Very likely they use city-issued supplies as well. Here we have the city-issued harm reduction kits strewn on the ground in Yorkville, about 30 meters or so from a public playground. We can see tourniquets, needles, etc. And then finally, we have another individual in the throes of crystal meth addiction, participating in this activity on the subway in full view of subway passengers, also using his city-issued, taxpayer-funded pipe. So everybody in this room calls what I've just displayed harm reduction, but a very large majority of citizens of Toronto call it harm production. Now, with regards to the annual report from the Medical Officer of Health, I noticed a few omissions, and I'd like to speak on those quickly. The first is the decline of olfactory health. What is olfactory health? Well, it's the nose. It's what we smell. And right now, a lot of people say the city stinks. Take a walk on the streets of Toronto. You will smell disgusting trash fumes emanating from our garbage bins that are busted. You'll smell the remnants of public defecation and even sewage in some places. Why is there no discussion of olfactory health? Because we know that is an important thing for public health. The scourge of public defecation is real, and there's no mention of it also in this annual report. What is Toronto Public Health doing to mitigate the scourge of public defecation? I just came back from Spain, and they have a wonderful network of public bathrooms. Their streets are spotless. Why do we not have that here? Also, the word detox or rehab appear exactly 0 times in this report. Why? Lastly, the words mental health are also missing from this report. And when we're talking about the impacts of mental health, we're not just talking about the mental health of drug abusers, but we're also talking about the mental health of law-abiding regular citizens and their children who have to witness the behaviors of these drug abusers. What about their mental health? In summary, this report leaves a lot to be desired. There are severe pressing issues that seem to have been glossed over, and taxpayers are wondering if we're getting value for our $307 million. Thank you.
Okay, any questions for this deputant? Seeing none, thank you.